Hey guys, Dr. Derry here, owner of Vision Health Services here in Jacksonville, Florida. And I recently got a question by a client of mine, someone near and dear to me, and they asked me if arthritis can be cured or if surgery is the only way to cure arthritis. And so I wanted to break that down a little bit. So yes, the surgery, such as surgery of a total knee replacement or total hip replacement, you can often have removal of the arthritis by the surgery, change the joint surfaces and make them metal or plastic, depending on the condition and depending on surgical techniques used, and that actually does get rid of the arthritis. Sure, like there's no longer that bony change that's causing the inflammation, that's causing the stiffness, the painfulness. Often helps out with deformities. So in the knee, there's often a valgus deformity or a foreigner being straight, and it does help with that, absolutely. But arthritis is throughout your entire body. It's not just one region. And so, can you cure arthritis in all of your body? Absolutely not. And the major joints are focused by especially surgeons to help improve whatever you have going on in that joint. So, can you cure arthritis? Well, sometimes the surgery can help improve the joint surfaces in that one specific area, but it's not going to help out for the rest of your body. And overall, arthritis is just an age-related pathology, and so you won't be able to cure it. The biggest things with arthritis is you just got to do symptom management. So like what's leading you towards your symptoms or what's not helping you. And I always frame it in the way with my patients of how to stack as many cards in your favor as you can. And so if let's say you have back arthritis, degenerative changes over time, and there are some surgeries to help improve the arthritis in your back, especially if it's causing severe nerve compression, that's reducing your ability to do things in your daily life. And there are some good surgeries for that. And also conservative care is really good too. So the best treatments for arthritis is long-term symptom management. So I wouldn't lean towards medications long-term. Medications can lead to increased hospitalizations and increased wear and tear on your GI system. And so we all know people who have had ulcers or negative GI effects from chronic NSAID use. And so you want to be careful of that. So it's not long-term management. And a lot of times my patients are on ibuprofen and Tylenol long term, and that's just not the most appropriate option. Now it does have its place, but not the most appropriate. So risk reward, you got to weigh those ratios a little bit, and I would be cautious with that. Risk reward ratio with hot and cold packs, and so a lot of times with arthritis, heat it does very well. A lot of people with stiffness, achiness love the warm shower, love using the jacuzzi here in Florida, and they have a lot of relief and they feel looser. Well, yeah, it responds very well. It loosens up the joint. What else loosens up the joint? Movement, right? Movement is probably the number one way to manage your symptoms with arthritis. So you learn movements that feel really good for you and that are appropriate from your back, whether that's appropriate for your back, whether that's from something you've learned by yourself or you've had a team of people to help you, such as a physiotherapist or physical therapist, chiropractor, or even going to group classes and just learning how to move and feel good and what to do and just gain some strength along the way that helps make you become more resilient and more strong. And so it's just about learning your body. Osteoarthritis or arthritis, they're the same term. There's no cure for it. Now, in some major joints, you can have your joint replaced, but you still have arthritis in other areas of your body. And so if I'm looking at people who want to live well into their 80s and 90s and want long-term management of osteoarthritis or arthritis, couple key factors. Movement. You've got to learn to move, learn how to move, learn what it should feel like. Symptom management, including using a hot pack here and there if you find it appropriate, learning how to do things differently when you do lose range of motion or ability based on the severe changes, if you have any. Arthritis is very fluctuant, it changes person to person. Some people may end up with just mild arthritis, some people severe, and you really don't know until you feel the joint and you know what it feels like. And physical therapists are positioned well to look at that because they look at hundreds of patients in your age range and thousands of patients actually, and they get to see what's normal, what's not normal, and how each person's body responds very differently. And so a lot of times when I'm working with people with arthritis and they want to learn how to move and feel better and have a better long-term management strategy, sometimes you do start modified weight bearing. So a lot of times that may be in a heated aquatic pool, or for heated aquatic therapy. A heated pool feels great, allows you to work from that modified weight bearing or partial weight bearing all the way up to land exercises or full weight bearing, and that's really where we live our life. And so I encourage people to do exercises there. Now, non-weight bearing exercises can be on the table like I have right here, and so you could do that. You just got to learn what to do. Also, the evidence is kind of mixed, and we notice that some people may be more predisposed to arthritis or have greater difficulty the more you weigh. And so you've got to be able to do do well to manage your weight. And so you want to make sure you're managing your weight appropriately so you can reduce the amount of stress and strain on your joints from everywhere in your body, right? We're talking multiples of your body weight every time we squat, every time we go up and down stairs. So that's something to consider when you're trying to long-term manage arthritis. Especially if you're considering surgery, like we got to know that you're a good surgical candidate and you're going to do well afterwards, and that's gaining some strength and losing some weight beforehand, depending on your body type and just what is specific for you. Other people like to say long-term management, or not long-term management, but other management strategies you might see is herbs or turmeric, or just ways to decrease the inflammation. Like the evidence is a little mixed there. You just got to be careful what you listen to and what you learn and find out. There's also some emerging evidence for anti-inflammatory diets, so ways to reduce global inflammation in your body. And so we all know of like Tom Brady, who does very high level athletics or later on in his life, and he uses a very plant-based diet, which is anti-inflammatory in nature. And so I do encourage people to look up anti-inflammatory diets when they really want to get serious about their arthritis and how to age well. If we look at what's called blue zones, so people in the world that live well into their 90s, even 100s, there may be a little bit of genetic factor there as well, but they mostly live on a plant diet as well as they move a lot. And so there's some things to be learned there, and that's what the emergent evidence is showing, is that arthritis is a global approach. So when I treat patients with arthritis, I'm a physical therapist. I go to their home, I treat them, and I know they have arthritis, but they want to move and do more and stay independent as long as you can. There's things that we're talking about. We're talking about weight, if that's appropriate. We're talking about diet, if that's appropriate, if they're not on a good diet already. And we're talking about learning your body and looking at your joints and figuring out what does well with you, because the movement changes the compression of the joint, which improves load management, which is your ability to do things. The load in your body is your body weight, or what you have to carry or do. So we load manage, and we do that by figuring out how it feels when you move, looking at your joint, giving you a good program to match where you are right now and realize what your goals are, and then we manage the program along the way. And so I show you what to do, how to do it, and what it should feel like. Excuse me. And then you're going to go through that program, and you're going to have some help, but it's going to be some work. And so I tell people every single time that your health is earned. What your outcome is in your control, and your body, you got to learn it, and you got to do what's appropriate. So you got to weight manage. You got to manage the load, and that starts with strengthening, movement, range of motion. You may use some heat along the way, short-term management of medication if that's appropriate, if you're a physician and you decide that's appropriate. Again, that's kind of an invasive measure. The other medication that you modify is your diet, right? Your food is medication. You put that in your mouth and you ingest it, and it has an impact on your body. So you've got to know that your diet's on point and figuring out what's reducing the overall inflammation in your body. And just finding a program that matches to you. Movement is pretty general, so I don't care if you dance, play pickleball, go hiking, or you like to go to your garage and do your 30-minute workout every day, go for it. Like, it's just about load management and movement, so you need to do something. So is surgery the only way to cure arthritis? Well, it does kind of remove it in that joint, but it doesn't cure it. You'll still have degenerative changes or arthritis in other areas of your body. Now, surgery is applicable for some patients, but not all. And I always have those conversations with everybody. It's just about risk reward, though. What's the risk of holding off on surgery and doing physical therapy or other conservative treatment? Well, you just risk losing some time, right? But what's the risk of having the surgery and not doing well for you? Like, there's greater risk there, and there's always risk with surgery. And all the surgeons that I talk to, they all are fans of trying conservative care first. You want to start from least aggressive to more aggressive. So least aggressive measures, movement, exercise, may use some heat here and there, just learning your body and learning what feels good, and just finding a program that works for you. Low risk things, right? A little bit higher risk is medication, even higher risk above that is surgery. So I hope you guys find something valuable from this. But that's kind of how I manage arthritis, especially in areas of the body when patients are really wanting a cure for it. And so we learn that arthritis is just symptom management, and osteoarthritis is different for everybody. So I hope you find this video useful. Be sure to check out my other videos that go over maybe some ways to stretch or move. And I also recently released a course that's about it's a self-paced independent course that's on arthritis and degeneration that actually maps out the month for you and what exercises to do and when for those with lower back degeneration arthritis. And so it allows you to go through independently many exercises, about 20 to 30 minutes a day of commitment, including ways to move better, feel better. And so you can not only be successful now, but in the future, so you can avoid the things that you don't really want to do for yourself, surgery, injections, etc. And so If you're looking to take control of your own health and stop relying on time and luck to get yourself feel better, that course may be for you. So check out all of that, subscribe to my channel, and I hope you guys get something from this. And if you ever have any questions, feel free to reach out. And like I said, my name is Dr. Michael Derry. I'm with Vision Health Services here in Florida, and keep moving.